so important to see what is the social support system that the patient has. Because let's say the first time you see an expert and you try to get advice, you will hear just 50% of what I'm saying. It's a stressful situation. You will not hear everything that I'm saying. So it's really, really helpful to have an extra pair of eyes, ears, etc. In fact, I encourage family to be there, as many as want, and then to also ask questions, write down questions, ask questions, etc. So that's really important. So in my role, as a medical oncologist, I very often have to work with other experts, and there's lots of overlap where I, for example, work together with urologists, radiation oncologists, other surgeons, for example. So it's a very multidisciplinary approach, and I would say it gets even more multidisciplinary as we get newer combinations and treatments, etc. So my job is to educate the patient, develop a treatment plan, and get the patient access to the resources, sometimes also for additional educational need. So, for example, we're talking about radiation versus surgery for certain situations. I send them to both, let them talk to both experts, and then we come back and have some shared decision making. Also, I would say sometimes patients want to be in contact with other patients who have gone through something similar. So many institutions will have patient support groups. There are also online patient support groups. One that's quite busy with kidney cancer patients, smart patients, for example. So there are many different ways to get educated, contact peers, exchange experiences. So it's a very important tool these days.